Funding for the Maddy Report is made possible by grants from the California Emerging Technology Fund, leaders in the quest for digital equity. The James Irvine Foundation, committed to a California where all low-income workers have the power to advance economically. Fresno State Associated Students, Inc., students serving students. BNSF Railway, moving our economy for 160 years. And The Wonderful Company. The Maddy Report is also made possible thanks to contributions from Harris Ranch Inn and Restaurant and E&J Gallo Winery. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Welcome. A 2019 study from California's Future Health Workforce Commission reported that the San Joaquin Valley had 40% fewer primary care physicians and 50% fewer specialists than the state's wealthiest areas. The result? Poor health outcomes for Valley residents. What can be done to improve the situation? Our guest may have the answer. He is UCSF Fresno Associate Dean, Dr. Michael Peterson. Welcome to the Maddy Report.
Thank you very much.
So can you briefly describe the UCSF Fresno operation?
Yeah, I'll be happy to. And first of all, I really want to thank you for the opportunity to talk about this pressing issue within the Central Valley that goes back almost half a century. So UCSF Fresno was established in 1975 to address the severe shortage of physicians in California's San Joaquin Valley as one of the first regional GME campuses in the country. Now, GME is the training of physicians that they do after graduating from medical school. And we have grown to the point where we're training more than 300 physicians a year here at UCSF Fresno. Over the last decade, we've also expanded our training to UCSF and UC Davis medical students. And in 2019, we were accredited as a regional medical school campus for UCSF with the San Joaquin Valley Program in Medical Education class. So in addition, we train about 300 UCSF and visiting medical students each year. And we are currently working with both UCSF and UC-Merced to expand the training opportunities available in the Valley and to develop pathways for our students from the region to go into healthcare careers. So we currently offer residency training in 8 medical and surgical residencies, as well as a oral and maxillofacial residency in dentistry. We also have advanced training in 17 active fellowships in areas like cardiology, intensive care medicine, and oncology. And roughly 50% of our trainees remain in the Valley to practice after they finish their training and to provide UCSF quality care into the communities. So we really strive to balance both high quality training expected of UCSF, as well as to train our students and residents in community engagement and cultural humility.
Yeah, I want to ask you some questions about that. One of the things that's going on here is that, a lot of doctors are baby boomers and they're all retiring. Is that making the situation worse?
That's making the situation potentially much worse. So as you talked about in the introduction, that we were created in part because of the shortage of physicians and the effect that has on healthcare outcomes. So right now, about 30% of the physicians in the Central Valley are over the age of 60, which means we're looking at retirement in that group over the next 10 years. And unfortunately, only 14% are under the age of 40. So backfilling the loss of those physicians who are retiring. So this is going to make the situation worse going forward. And that's why increasing the production of physicians at the medical school and residency level is so critical for us to address the healthcare needs in the region. Despite the fact that we've been producing 35 to 50 physicians who stay within the region when they finish our training, our ratios of physicians to population has remained relatively flat because the San Joaquin Valley has grown significantly over the 40 years that we've been here.
Let me ask you, I want to touch on something that you brought up earlier, and that's diversity. I'm just wondering, we've got a very diverse population. Does it matter whether our physicians mirror that diversity? Is there any health implications of that?
Absolutely. That First of all, if we look at what the numbers are right now, we have a very large Latino population, and only 6% of the physicians in the state are Latino, and only 8% of the Central Valley. So clearly misaligned with the patient population. And people of color in this country have long had an understandable issue trusting physicians. And studies that are now in the literature demonstrate quite clearly that when we can match up the physician's ethnic and racial background with those of the patient, that health outcomes are much improved. So we're addressing this in a couple of different ways. With a lot of diversity training for our physicians, but also to try and increase the recruitment of physicians into the workforce that reflect our communities.
Well, I want to thank Dr. Michael Peterson with UCSF Fresno for joining us. Up next, politicians as well as business and civic leaders have been advocating for a new medical school in the Valley for some time. But there's many who's thought that the UC campus at Merced might be the beginning of that and move this issue forward. Was that optimism justified? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. The establishment of a University of California campus at Merced in 2005 was recognized as an ideal opportunity to help address the shortages of physicians and also address the public health issues facing the San Joaquin Valley. But building a brand new medical school is no small task. What is the current status of the project? Are we any closer to having a medical school in the Valley? We'll ask our next guest, University of California Merced Chancellor Juan Sanchez Munoz. Welcome back to the Maddy Report.
Good to be with you, Mark.
So can you give our audience an update on where things stand on building a new medical school at UC Merced?
Yes, of course. Well, we're very excited about the progress we've made so far in the development of this particular initiative. In UC Merced in 2023, in the fall, we'll begin accepting its early acceptance 8-year BS to the MD program for 12 students. Again, that will begin in the fall of 2023. These students will enter UC Merced as freshmen with the provisional acceptance to UC San Francisco School of Medicine, contingent on meeting certain academic metrics. The idea is that the BS to the MD, that they will begin their education year 1 through 4 at UC Merced, that you do years 5 through 6 in clinical training at UC Merced, and then years 6 through 8 will be their clinical training, actually preclinical at UC Merced, and then clinical at UC San Francisco in Fresno. And so part of that enterprise includes this building that we've been discussing.
I'm going to ask a question about this connection with Valley students on homegrown in a second. But I want to ask you before that, I want to ask you about, one of the things you guys have been known for on the cutting edge nationally, actually, is developing these public-private partnerships as you build out your campus. I'm wondering, is that also going to be the model of building out a new medical school?
Well, what we're hoping to work with, of course, the Board of Regents have the authority to request through the legislature an appropriation for this particular building. We, as you know, the P3 project at UC Merced called the Project 2020 was the largest in U.S. history. We built over 11 buildings, almost over a million square feet, a price tag of 1.3 billion approximately. And so that was very transformative. We're hoping that we will receive some support from the legislature or some federal resources to construct the building, which is currently costed out at approximately $210 million. But this is a facility that will not only house our medical education program, Mark, it will also house public health program, as well as our psychology program, and potentially even other areas that emerge, such as nursing.
Yeah, it's pretty amazing. You look at the campus. I encourage people, if you haven't been to UC Merced, take a drive up there, go see the campus. It is very impressive what you've built. But the other thing that's really interesting is this idea, getting back to this homegrown idea. You're a big proponent of that, as witnessed by this groundbreaking agreement you have with Merced Unified School District to automatically admit students to UC Merced if they take certain classes and get a GPA of at least 3.5. Do you see a similar advantage to providing medical education to Valley students?
Well, absolutely. That one of the themes of the particular medical education program that we want to inculcate here in this program of study at UC Merced is the idea of preparing physicians to work with those that are from rural communities certainly like those across the valley, that understand the culture, the circumstances, the finance, the language issues, etc., and be able to provide the best possible medical advice. Many might not be aware, but there's a conspicuous shortage of medical professionals across the valley, 1/3 of what is normally available across the rest of the state. And so there's a conspicuous and persistent underservice of medical professionals across the valley. And that what we hope to do is work with our partners, UC San Francisco and UC San Francisco and Fresno, to address this fairly conspicuous deficiency.
Yeah, it's interesting. A lot of the students who go to Valley universities have a tendency to stay in the Valley, which is unlike a lot of other universities. A lot of universities, you go there and then you leave, right? But in the Valley, the homegrown, it really does seem to work. No pun intended with agriculture. Let me ask you this last question. What is your vision for medical education in the Valley? I mean, what should we expect to see from UC Merced in the future?
Well, we certainly hope to construct this brand new facility and add that to the campus and add that amenity and that capacity to the Valley, to begin to admit entire full cohorts here at UC Merced, working with UC San Francisco and Fresno, and then identifying the clinical sort of residency appointments across the Valley. And as you said, many of these we hope will be from the Valley, interested in being medical practitioners in the Valley, across the Valley, and that will stay here in the Valley. And so we think that this is an ideal solution to providing the kind of medical care that the people of the Valley, across the Valley, deserve. And we're very excited to be a part of this. And Mark, this is something that was discussed. You mentioned the founding of the university. If you study the history of the UC Merced, it was always part of the original conversation of UC Merced to eventually provide this kind of training and graduates.
I went back and I did some research, and yes, you're absolutely correct. It's from day one they were talking about this. So it's nice to see it coming to fruition. I want to thank our guest, UC Merced Chancellor Munoz, for joining us. Well, up next, for Chancellor Munoz's vision to become a reality, it's going to take a financial commitment from both the state and federal government. Are they willing to make that investment? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. Building a medical school in the Valley is going to take a major commitment from the state, and that's only going to happen if our Valley state legislators make it a priority. Well, our next guests are two Valley legislators who have made it a priority. They are Assemblymember Adam Gray of Modesto and Assemblymember Joaquin Arambula from Fresno. Welcome back to the Maddy Report.
Thanks for having me back.
So let me start with you, Assemblymember Arambula, first. There's always been, it seems like a competition for state dollars. In many situations, though, dollars flow to where the voters are. So it's not surprising the last medical school that was built was in 2008 in the Inland Empire at UC Riverside. Now that school's been built, does that make the Valley Medical School a little bit higher on the list of priorities?
I think when we look at the data, it's obvious that we have a need for more providers in the San Joaquin Valley. I'm pleased to be advocating to bring more bacon back home so we can train our own to be the future workforce. It's important in the last year's budget that we were able to secure $15 million ongoing to help with the establishment of that medical school right here in the Valley. While there are long-term goals for us to similarly accomplish, I'm encouraged by the advocacy that we've been able to do thus far.
Some of them are great. Where's the governor and your legislative colleagues on this issue?
Well, I think this is probably an area of healthcare public policy that's least looked at, right? We spend a whole lot of time and energy talking about expanding coverage, and certainly that's an important goal and something that both Senator Arambula, myself, and our colleagues have focused on in the last 10 years. Having said that, when you've got counties like Merced, which is my home county, which has about 90 physicians per 100,000 people, and you have counties like San Francisco that have nearly 500 physicians per 100,000 people. That's an apples to apples comparison. Having insurance, just lands you right back in the emergency room, which is frankly the same place you'd be if you didn't have insurance. And so we've got to focus more attention on this. The governor's clearly embraced the effort by supporting the $15 million that we asked for in last year's budget, but we got to do more. I mean, eventually we're going to need $25 to $50 million per year in revenue to support the program. And we're going to need initial infrastructure investment of probably $300 to $400 million to get the necessary classrooms and space, both at the UCSF campus in Fresno, as well as the UC Merced campus in Merced.
Well, yeah, and the budget, we're doing quite well this year, so we'll have to see what happens there. But, I'm just wondering, and some of the members agree, with the pandemic, it's kind of shown us two things. Number one is it's really underscored the disparities between the coastal areas and the inland areas like the Valley. But the second thing it's done is it's really made telemedicine kind of something that people are more willing to do. So I'm wondering, does telemedicine answer the problem of medical professionals in the Valley, or do we still need a medical school?
I certainly think we still need a medical school. I mean, I'll let the good doctor give his opinion, having worked in our healthcare setting there in Fresno and working on the subcommittee. But the reality is, while telemedicine may be a great solution to bring in certain specialties from our urban areas that we may not be able to support in rural communities, it's not a good substitute, in my opinion, for your family care, for your doctor that you go see. As you
I'm sorry. The other issue is just that the broadband doesn't exist right in some of these smaller rural communities. So Assemblymember Arambula, what are your thoughts on that?
Thank you. And I did appreciate the reference to the emergency room earlier. It brought me back to some of those days when I was on the front lines of healthcare. And I do use that experience of having patients lined up out the door to remind me of the need for more providers every day in our communities. And I believe that telehealth is a complement to what we're trying to do to bring more providers as well. It's another way in which we can support accessing care. Specifically, we've seen tremendous advances in behavioral health in this space. And during this pandemic of the century, I think it's important for our community to make sure they have access and avenues that are not traditionally the way we saw it, but frankly can be an improvement to the way in which we deliver care and is a necessary part of what we're doing in healthcare right now.
We've only got about 30 seconds left in this segment, but I want to ask both of you quickly. So what is your prognosis, no medical pun intended, about having a medical school in the Valley? Assemblymember Arambula, is it going to happen?
I left my practice so I could return with a medical school that we would have right here in the San Joaquin Valley. I intend to make sure to continue that advocacy until it's completed.
Okay, Assemblymember Gray?
It's happening. We just got a briefing from UC Merced, UCSF just recently that had the first graduating class of medical students in, I think, 2028 or 2029. So those students will be starting at UC Merced here in the near future. And it's up to Dr. Remy and I to just keep pushing forward, more funding, more opportunity, grow the med school here in the Valley.
Well, I want to thank our guests, Assemblymember Joaquin Arambula and Assemblymember Adam Gray, for joining us. Up next, it's going to take a commitment, not just from the state, but from the federal government to make this happen. What are they going to do about it? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. Perhaps the Valley politician who's been advocating for a medical school for the longest, first as a member of the state Senate and then as a member of Congress, is our next guest, Congressman Jim Costa. Welcome back to the Maddy Report, Congressman Costa.
Well, Mark, it's always good to be on the Maddy Report. You do such a wonderful job here in providing information as a public policy institute for the people of the Valley and our students as well.
Well, you had something to do with that. You were one of the founders in terms of helping with the enabling legislation and also a member of our board of directors. So thank you for that. But let's talk about the issue in front of us right now, and that is a Valley Medical School. You've been pushing this for a long time. Why?
Because it's important. We have a shortage of physicians here in the Valley. For every 1,000 people here, we have 0.9 physicians, less than one. Any other part of California you live in, for every 1,000 people, there's 2.2 physicians, or twice as many physicians. We've had a residency program as a partnership with the University of California, San Francisco that's been very important for 45 years. Almost half the residents that have participated in the program have stayed to practice here in the Valley. So we know that a full-fledged medical school would not only increase the numbers of physicians, but those that would locate here and provide an opportunity for students from the Valley who are more likely to practice if they become a physician. So we have regional shortages across the country, and we are one of those areas that has a shortage.
Yeah, we were talking with UC Merced Chancellor Munoz, and he made that very point about the importance of homegrown physicians. So I think that there's a common theme here. Let me ask you this: some people think that with the advent of telemedicine, particularly that's been encouraged after a COVID explosion in telemedicine, they're saying, you know what, maybe a medical school is no longer necessary because you can access physicians from outside the area. What do you say to that?
Well, telemedicine's important, and we've found its application here. But we still have challenges with broadband and people having access to the internet and being able to get the necessary health care that they can. And so, yeah, there's no substitute for physicians or nurses. A pandemic has taught us that, and the demand for more accessible and affordable health care will only grow. And therefore, a medical school is critical here for this valley and other areas of the country that are underserved.
Yeah, I mean, your point is very well taken. I mean, one of the big issues is the digital divide in the valley. So, even though people are accessing telemedicine around the country, in the valley, there are certain pockets, smaller communities that don't have that access. Let me ask you this. So you've been a member of Congress for a while. What have you been doing to push this issue in Congress?
Well, we have legislation that we will hope is part of the infrastructure package that will create an authorization for universities wanting to build new medical schools or expand existing medical schools. And that will benefit not only our valley, but other parts of the country, again, that are underserved. We hope that legislation will be a part of the package. We have the support of the leadership in the House. Senator Kane has a similar measure on the Senate side. And we've got this on the radar screen of the Biden administration and Secretary Becerra. And so we're very hopeful this year we're going to make it happen. Governor Gavin Newsom has put $15 million aside for the purpose of establishing this medical school.
Well, you've also, I mean, it's not just the medical school. You've also been involved with the VA hospital in Fresno, and frankly brought a lot of money home for that operation as well. Correct?
Absolutely, and the plan for the medical school here is called a regional concept, a distributive model. So unlike Davis that has a hospital in Sacramento or UCLA that has the Reagan Hospital on campus, we'll use the existing hospitals here in the area. We have 6 good hospitals here in the area, second largest in the state with CMC, a veterans hospital, Valley Children's Hospital, the Catholic Hospital, and clinics that provide rural health care. And getting training in clinics is so important for physicians that we need to serve the people of this incredible, wonderful valley that in some cases we have a lot of distances between folks. And so having the ability to drive 60 or 80 miles to a hospital is not so easy.
Let me ask you this. We've only got about 15 seconds left, but very quickly, yes or no? Is it going to happen?
Yes.
Well, there you go.
It's going to happen because we've worked hard on it. We got a lot of support for it.
All right. Well, I want to thank our guest, Congressman Jim Costa, for joining us, and you, our audience, for being with us. This is Mark Keppler for the Maddy Report. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.org. If you want to stay up to date on state and local politics, you can sign up for our free e-newsletter, the Maddy Daily, by logging on to our website at maddyinstitute.org.